Hi everybody, my name is Melissa Koehl. I'm a doctor of physical therapy and Pilates instructor. Today we're going to go through an intro level Pilates class that focuses on neutral spine position. So this is going to be a very gentle workout, all in neutral spine. So we're not really going to do any bending, extending, twisting of the spine. There are many situations where you may want to do those kind of stretching movements of the spine, but then there are certain days or certain conditions where sometimes it just feels best to keep your spine neutral. So that's what we're going to focus on today. The only equipment you're going to need is a mat, or you can even do these exercises on the bed or a couch. And you may want a towel, like a small towel, or a t-shirt for a stretch we're going to do at the end. We're going to start laying on your back with the knees gently out to the side. This is a yoga position called Supta Konasana. I know this is a Pilates class, but we're going to start with a little bit of yogi breathing just to get our minds and bodies connected and ready for the workout. So feet together, knees gently fall out to the side. If there's any hip issue, you can just keep the knees bent. Otherwise, take a moment. We're just going to relax here, close the eyes, and just take a few breaths. Inhale through the nose, and exhale through the mouth. And as you inhale, we're going to let your belly fill up with air. And as you exhale, let the belly drop down, starting to activate the diaphragm. Breathe in and out. And if you're not sure if you can make the breath go in and out from your belly, don't force it. Just see if you can notice where you do feel the breath moving. You're going to relax your shoulders down into the floor or your bed. Let your head be heavy. Very good. And then on your next breath, we're going to bring the knees back up over the hips. You can open the eyes. We're going to take another big inhale, this time letting your ribs expand. Out to the side, inhale. And then as you exhale, draw the belly button in toward your back. And then we're going to start a small marching movement. So keeping the belly pulled in, core tight, tailbone is going to glue to the floor. We're going to inhale, lift your left knee up over the left hip. Press the shoulders down onto the floor. Engage your abs. We're going to lower that left heel, barely touch it to the ground, and then bring it right back up again. I'm going to lower down slowly. Inhale on the way up. Exhale on the way down. And you're going to imagine that there's a pair of suspenders holding your rib cage to your pelvis. So as the leg goes down, the pelvis stays right where it's at. One more time. And then we're going to switch sides. Left foot down, bring the right knee up. Inhale as you lower down with control. And then exhale to come back up. Inhale. And exhale. Nice job. So all the attention is on the core and the spine. Your leg probably knows how to move up and down. The effort is in keeping everything else stable, even though the leg is moving. One more time. Nice. Now we're going to bring your right arm up overhead and at the same time lift the left knee. And then exhale, bring it all back down. Inhale. Exhale, pull the belly in. We'll lift the left arm, right knee. Pause and hold here at the top. And then exhale, let it back down. Inhale. Full exhale, engage the core. Right arm lifts. Left knee comes with it. Exhale to come down. Breathe in. Exhale, belly to the spine, left arm, right knee. And bring it back. One more time on each side. Just float everything up. Nice and gentle. Exhale, bringing it down. Inhale. Exhale, engage the abs. Left arm reaches up overhead. Pause here for a moment. See if you can feel the bottom of your rib cage on the floor. If you don't, if you've noticed it's arched up like this, see if you can connect again. Bottom rib cage on the floor of the bed. Abs engaged. And then bring it back to the center. Nice job. Glue your heels to the ground. Bring your feet in a little closer. So now we're going to give the abs a little bit of a break and start to work the back half of the body. You're going to glue your heels to the floor, squeeze your glutes, and then start to peel your tailbone up a couple inches from the floor. You're going to lift the chin, keep your shoulders glued to the floor, and then slowly bring it back down. Full breath in, and then exhale, squeeze your glutes, press your heels to the floor, start to lift those hips. If you get any discomfort, if you go higher, just keep it at a little bit of a lower bridge to start. You might be able to feel your hamstrings, your glutes, your lower back muscles all starting to engage here. And then lower it back down. Breathe in. Exhale, squeeze the glutes. And lift it up. And hold, hold, hold. And slow to let yourself back down. Full breath in. Exhale, tighten the booty, lift it up. Once you're in your bridge, you're gonna imagine your tailbone tipping down toward your heels. So keep some length in the lower back. And lower back down to the floor. Good. We're going to keep your right leg right where it's at, then bring the left knee back up over the hip. Straighten your knee as far as your hamstrings will allow, and then we're going to start doing a small circle with that left leg. Good. If you need for balance, you can bring your arms a little bit wider. And as your hip starts to loosen up, you can start to make the circle a little bit bigger. And then circle the other way. Inhale as you go down, exhale as you come up, and you're going to keep your pelvis nice and still. And then we'll stop here in the middle, extend your leg a little longer, lift that side down, and switch. Right knee over right hip, extend it, and then start with the small circle. You're going to use a little bit of strength in that left leg to push your foot into the floor. And then circle the other way. Exhale, exhale. Every time you come back up, kneecap stays pointing at your face. Good. 2 more. Shoulders glued to the floor. We'll bend the knee and bring it down. Good. Arms by your side. And then next exercise, we're going to tuck the chin and do a little bit of a crunch. See if you can pull the head and shoulders up, shoulder blades back, head in line with the rest of your spine. So check that we're not sticking your chin forward. Pull it back a bit. And bring it down. Inhale. Exhale. We're going to tuck the chin, Lift up the shoulder blades. Pull the belly in toward your spine. And roll it back down. One more time. Crunch it up. If you can hold here, we're going to pulse the arms. 1, 2, 3, 4, 5. Exhale, 2, 3, 4, 5. 2, 2, 3, 4, 5. Exhale, 2, 3, 4, 5. 3. A hand can go behind the head if you need a little support. 4. We got 2 more to go. 5. Exhale, 2, 3, 4, 5. And 5. 2, 3, 4, 5. You got it. Exhale, 2, 3, 4, 5. And roll back down to the floor. Fantastic job. All right, so we're going to give the abs a break and then turn to your side. So you may want a pillow for your head. I just happen to have one handy. Or you could do a hand under your head. So you're going to be directly on your side, shoulders right on top of each other. So top shoulder exactly on top of the bottom, top right hip on top of the bottom left hip. Pull the belly in, lift the waist, just enough that you could imagine a tiny space here between your waist and the mat. And then you're going to extend the top leg out to the side. Use your hand for balance, push down to the floor, and then we're going to lower that top leg down and up. Inhale on the way down, exhale on the way up. Your waist is going to stay long. So the distance here between the top of your pelvis and the lowest part of your ribs is going to stay just where it's at. And up. Good. Inhale and exhale. Shoulder blade relaxed out of the ear, down. Lift and squeeze. Bring it down. Lift it up. Good. 2 more. Down and up. And 1 more time. And squeeze and hold it using the hip. And then bring it down. You just bring the knees in front of you at about 60-degree angle here. So knees are bent, if you can see, 90 degrees, and then about a 60-degree angle here at the hips. We're going to keep the belly pulled in toward your spine, hips stacked, and then heels together as you lift that right knee up into a clamshell. And down. Up and down. You can use a hand on your hip here. We're going to make sure that your pelvis stays just where it's at. The tendency sometimes is to lean backwards to get your knee up. But what we want to do is keep your back and your pelvis still and just twist inside that hip joint. You may not bring your knee as high, which is fine. So we want to isolate the rotators of the hip here. Good. And down. And bring it up. And down. 2 more. Up. And down. Hold this last one. Belly in. Long neck. Relaxed shoulder. And then we'll come back down. Good. And then you can just turn to your other side. If you have any sensitivity in your back when you're turning, you're going to keep those abdominal muscles engaged while you turn. So shoulders and hips move together. I'm going to flip around just so you can see what I'm doing. Otherwise, you can just turn. And then we'll lay on the other side. So head on your pillow or your hand. Shoulders stacked, hips stacked. Extend the top leg. See if you can flex the toes. And then start to lower that leg down and lift it up. Inhale and exhale. Good. Long waist, long neck. You almost want to imagine like someone's pulling your foot away from your head. Inhale, exhale, lift and squeeze. Working your gluteus medius muscle on the side of the hip. Really important muscle to give your pelvis and your trunk stability when you're standing and you're walking. Super important muscle for balance. Good. 2 more. Lift and squeeze. And lift and hold it here. Imagine someone's pulling that foot before we let it down. Nice job. So then clamshell. 60-degree angle at the hip, 90-degree angle here at the knees. Belly button pulled in, heels together. We're going to lift that top knee up. and down. Lift and down. Check in with your neck. See if you can keep your neck as relaxed as you possibly can here. And let your hip do all of the work. Core is engaged. Hip rotators, lifting your knee up. Good. Without any twisting in your lower back. So spine neutral, up and down, up and down. You got it. 2 more times. And down. Keep your body long, up. Hold this last one. Really start to feel those muscles activate in your glutes. And then we'll come back down. Awesome job. So then we'll turn back onto your back, and you're going to want to grab your towel, t-shirt will work, yoga strap, whatever you have. You're going to bring that behind your right knee. Then make sure you've got the towel in both hands. Take your left foot, cross it on top of your right knee. Just going to take a deep breath here. Let the left knee start to drop out to the side. In fact, you can take your hand and give your left knee a little push. And then we're going to grab the towel and pull both knees up until you feel a stretch in the back of that left hip. Now, if you are able to grab with your hands behind your knee, then you don't need the towel. But if that's at all challenging, use your towel to help. Take some nice deep breaths here. As your muscle starts to relax, we'll bring the knees in a little closer. And then bring it down. And then keeping your towel behind the knee, you can lift the right knee up and extend your left leg along the mat. So use a little bit of help here for your leg. And then start to stretch the right leg up. And let it relax down. Inhale, stretch it up. And exhale to bring it down. It's a nice gentle hamstring stretch here. Also getting a little bit of mobilization of the nerve tissue along the back of the thigh, mostly your sciatic nerve. So inhale to stretch up and exhale to come down. Now, stay with this if that feels like enough of a stretch, or if you're ready for a little stronger stretch, we're going to hold it with your foot up and then flex your toes back toward your nose and then relax. Flex the toes back and rest. So just for 1 or 2 seconds, toes back, let them rest. And 3 more here. And down, good. Stretching the calf, stretching the hamstring, stretching all of that nerve tissue up and down, and then we'll bring it down. Good. So with that last one, as you're gliding the nerve, if there's any numbness or tingling, you back off right away. It should just feel like a gentle stretch, back off, gentle stretch, back off. Maybe a little bit of discomfort at the most, but definitely not numbness or tingling. Just to be clear on that. Okay, so then we're going to switch. Towel behind the left knee. Right ankle to left knee. Pause here for a moment. Take the right hand, give your knee a little push away. And then we're going to bring both hands to your towel and then hug both knees in close. Just let yourself breathe. Notice what sensations you feel in the hip or the lower back. If you want a little deeper stretch, you can start to lean your legs to the left. Otherwise, just stay where you're at and continue to breathe. Good, we'll take 2 more breaths here. And we'll let the legs down. And then this time, extend your right leg. Bring the left knee up over the hip. And we'll start to stretch the left knee up and back down. Sorry, the left foot up. Inhale, left foot up. Exhale, let it relax. Inhale, reach. And exhale. If you notice any back pain when you do this, you just go into the point where you start to feel the pain. Just knock on the door, say hello to it, and then back off. Inhale and exhale. You should feel, as you stretch and mobilize the muscles and the hamstring and that nerve tissue, that sensitivity gets better as you do these repetitions. So it becomes a little less uncomfortable. Certainly for any reason, if it starts to ramp up, it gets more flared up the more that you do, then you just back off. So just listen to how your body responds. In general, these kind of gentle movements feel really good and are safe. And then if you're ready for more of a challenge, we'll flex the toes and point. Flex, point. Toes to the nose. Let her relax. And exhale. Continue to breathe. And one more. Awesome job. You can let that knee down. And then when you go to sit up, we're going to tighten the belly, log roll, so shoulders, hips all move as one big piece. And then use your hands to bring yourself up to sit. All right, and that's our class for today. Thanks for joining me. If you have any questions, you can leave them in the comments below. And thanks for watching.